Okay. Then first thing we're gonna do is Javier, would you do the roll call, please?
Veronica Escalera Ibarra,
Present.
Lyle Hufstetler, Christina Solorzano.
Alexis Brother.
Yes. Jeff Jordan, Victor Sains.
I'm here.
If you're, okay.
Victor's here.
Yes. Carly Farmer, Brandon Ross, Joshua Jeschke,
Here.
Isaac Levy, Erica Taft, Bill Hill, Scott Wayman,
Yes, sir.
Ryan Flipson,
Present.
Kurt McKell,
I'm here.
Joey Pollock,
Kenny Skrobanic here, attending on Joey Pavlik's behalf as his alternate.
Robert Hanley,
Here.
Karen Bishop, Yvonne De La Rosa,
Here.
Marcela Diaz Wells, Chair, we have quorum.
Exactly. Let me ask you a question. Roll call. Karen at a previous meeting has retired and left the city.
Yes,
So,
we still do not have, well, I should have called her alternate, but.
yeah,
Where-
as what you did in the meantime, to the next meeting, call Jordan to see if she'll be the primary and ask Sanction River Authority if they have another candidate.
They do, we just need an official confirmation letter.
Okay, all right, fair enough. Do we have any citizens to be heard?
No.
Okay. Agenda item 3 is the approval of the May 8th, 2024 meeting minutes. And if there's any corrections or amendments to those meeting minutes, I'll entertain that. And if not, I'll entertain a motion to approve the May 8th meeting minutes in a second.
Motion to approve.
Who's that?
Scott?
Okay, Scott, thank you. Do I have a second?
Second.
Charlie?
Yeah.
Aye.
All right, I have a motion from Scott and a second from Carly. All those in favor signify by saying aye.
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 Same sign if anybody opposes the meeting minutes. Not hearing any, the meeting minutes are approved from May 8th. And we'll move to agenda item 4, which is a discussion and appropriate action on the Active Transportation Advisory Committee Micromobility Representative application. Matthew, go ahead. Yours.
Right. Give us a second to get this presentation up. This is going to be a continuation from the last meeting. For those of you who don't know, we had San Antonio apply to be our micromobility representative on the Active Transportation Advisory Committee. It's right, we just have to go to the top. And so we had some questions about the FTA definitions of micromobility versus microtransit. So I'm bringing back a little bit of research so that we can make an executive decision here today for the committee on whether or not we accept SAGO as our shared micromobility provider representatives. So again, the issue, San Antonio applied as the micromobility provider. It is unclear if they would qualify as micromobility or if their services more closely align with microtransit per the FTA. And we need to come to a consensus on whether it qualifies as micromobility or microtransit. We make this distinction because this October, we will be adding in a multimodal representative, which encapsulates everything. So if we choose that they are microtransit, they are free to apply for that position this coming October because that will include microtransit. Just a little bit of background on their application. Once again, they're seeking this appointment to offer our service to the community and help provide last and first mile micromobility in a sustainable way. When they asked to describe how they will share information with their constituency, they asked that they said they will share information digitally and in person. And for education, they listed that they have been in micromobility since 2019 and have been a frequent visitor to the areas of our city that would benefit from this type of service. This is a picture of what that service looks like. It is a very small vehicle. It's completely electric and it holds about 6 people. You probably see them rolling around downtown San Antonio. So the FTA definition, specifically, micromobility is any small, low-speed human or electric-powered transportation device, including bicycles, scooters, e-bikes, e-scooters, or other small, lightweight, and wheeled conveyance. While microtransit is a technology-enabled service that uses multi-passenger vehicles to provide on-demand services with dynamically generated routing. Microtransit services are typically provided in designated service areas. Service models include first, last mile connections to fixed route services, hub-to-hub zone-based services, the commingling of ADA complementary paired transit services with general transit service, and point-to-point service within a specific zone. So what does that mean for SAGO? It is staff's recommendation that San Antonio Go be defined as microtransit. There are a couple of reasons for this. One is that they are a first mile, last mile service, just like outlined in the FTA's definition, as well as a multi-passenger service. If you looked at the micromobility definition, they are all for single passenger vehicles, whether human powered or e-powered. Microtransit are for those multi-passenger vehicles. In addition to the service model of San Antonio Go, it is going to be point-to-point service within a specific geography. That geography is the downtown area. So it is staff's finding that San Antonio Go more closely aligns with microtransit and would better fit with the multimodal representative coming online this October. So the requested action here, it says motion to approve. In this case, staff recommends denial of San Antonio Go as the shared micromobility provider representative on ATAC. And we can open this up to discussion.
Yes. Motion, and you seconded, you seconded, okay. Did you get that over here?
Yes, sir.
Okay. Yeah, well, let's discuss it. I
love semantics.
Yeah. I like this because I always worry about in these things when you sort of make exceptions to the rules and regulations, other people want to come in and make exceptions to another one. So I think you've given them an out, Matthew, for October. So I'm going to agree with the motion. But is there any other questions from anybody online or here in this room today?
Kenny Skravanik here. How many spots in October will open up for that category?
One.
Thank you.
One primary and one alternate. I should
Got it.
say.
Thank you.
Matthew, this is Josh. Do we have a definition for micromobility that we're going to be using for that position?
For the multimodal?
Correct.
Not necessarily. It is anything that has to do with pedestrian,
Sure.
cycling, or transit as a whole. And that can include a governmental organization, agency, or a community organization. So the multimodal is specifically going to be broad to allow that
Understood.
kind of flexibility where we don't have it with the other representatives.
Understood. Thank you.
Any other comments from anybody else? Okay, we have a motion on the floor in a second. And I'm going to do this again. All those in favor should signify for the denial or to approve the staff's recommendation for the denial of this application. Did I get that correct, Matthew?
Correct. Deborah just had a question real quick I can answer. They do not have accessible shuttles.
All right.
Can you clarify the motion that's on the table again, please?
What did I say? I'm here. No, the staff is recommending a denial of the application for San Antonio Go to be in the category of micromobility based on the FTA's description. And so we have a motion and a second to agree with the staff recommendation of denial of the application for that particular slot. Sorry, I wish I could have done that in a more abbreviated form. Follow up?
The alternate being microtransit. Is that correct?
Microtransit's coming up in October.
Micro or multimodal is in October. And that includes microtransit. So,
All right, if there's no more further comment or discussions, I'm going to call the vote. All those in favor of the staff recommendation for denial of the application on SA Go signify by saying aye.
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 Thank you. Any people oppose that? And if you do, tell me who you are. Okay, the motion carries. Thank you. The next item on the agenda is number 5 is presentation of safety statistics for the AAMPO area, January to March 2024. Again, that's Matthew.
all right, we haven't done one of these in a second, but we're going to sum up the CRIS database crashes that we have received from TxDOT for January through March of 2024. That includes the number of total fatal and severe injury crashes in the first 3 months of the year, number of people killed, number of people severely injured, the number of people walking that were killed or severely injured, and the number of people cycling that were killed or severely injured.
So let's go back a minute, Matthew, please. Is the number 1 bullet point a summation of the bullet points underneath it?
No.
So what's the difference between total number of fatal crashes and the number of people killed?
So there can be multiple people in a vehicle. So the first bullet point is the number of crashes.
It's a metric, it's just the number. Okay.
Correct. And the rest are talking about the people involved in those crashes. So
Thank you.
all the data comes from TxDOT's CRIS Records Information System, or Crash Records Information System called CRIS. The most recent crash data tends to be a little less accurate since police continue to upload crash reports. They have a certain time frame to do so, but obviously the more recent that data is, the less time they've had to upload that data. So generally, the longer that data, the older that data is, the more accurate it will be because that gives them more time to upload those police reports.
Matthew, let me ask you a question, clarification. If it's unreported and there's no law enforcement response,
It will not be up here.
okay, regardless whether it's a fatality or an injury.
Correct. Crashes. All fatal and severe injury crashes are required to be reported by the police. But that means that any crashes that happen, say a fender bender that was figured out between the two parties and was never reported, is not shown on here. Any accidents that happened that were not reported to the police will not show up here. Any near misses, not shown up here. So we actually say that TxDOT's CRIS does not track crashes with no law enforcement response, unreported crashes, near misses, etc. So just keep that in mind while I report out some of these numbers. This is the map of 2019 through 24 data. The blue being, can we get rid of that up there? The blue being severe injury crashes, the red being the fatal crashes, and the dot size is the number of people involved in each of those crashes. For all intents and purposes, the data I'm showing you today includes all of Kendall and all of Medina. So just keep that in mind when you see some of these numbers. We aren't able to do the cut of the MPO boundaries on our GIS table, so it will include the whole of those counties. We're including Medina since they will be joining the MPO very soon. And I put some of that information. Kendall County is expected to join AMPO fully next year, and Medina is expected to join up to the west side of Hondo next year as well. So that's why we're including them today.
West side of the road or the east side?
West side. We're including the city of Hondo. So the total number of fatal and severe injury crashes in the first 3 months in the AMPO service area this year is, this says people, this should be crashes, 239 crashes this year. That blue line is going to be the actual number from year to year, and that red line is the 5-year slope, looking at the numbers. So as you can see, the red line, our slope, we are increasing the number of crashes we see within the first 3 months over the last 5 years. That slope is increasing. The number of severe injury, the number of fatal crashes this year was 56 in the first 3 months. 56 fatal crashes. We had kind of a bell curve in the last 5 years for the actual numbers, meaning that the 5-year slope has pretty much stayed flat over the 5 years. That, again, I do want to emphasize, as police update the reports, we are likely to see an increase. It is still fairly early for them to update those reports, so these will not be the final numbers. But this is a map of where those crashes occurred. It's a little hard to see for those in person. Sorry about that. We do have these on our website as well. We do our best to update them as much as possible. As you can see, most of them are going to be in Bexar County, but we do have some in the Comal County areas, as well as along some of the major interstates. We also found that 7 p.m. had the most number of fatal or severe injury crashes, just total number, but generally that's a thing at a greater frequency of fatal or severe injury crashes as well. So now we're going to be talking about the people within those crashes. We had 56 people killed in the first 3 months in our AMPO area as a result of those crashes. This is significantly less than 2023 and 2022. Again, we're still waiting on police reports. That number is likely to go up as those reports come in. The 5-year slope right now is fairly flat, a little bit of an increase on that slope. We're likely to see that increase as we get more police data. These are where the fatal crashes happen. Again, the red dots are where those crashes are located, and the size of the dot is how many people were involved in that crash. And it's working. The number of people killed in the first 3 months of this year, again, 7 p.m. had the most number of deaths across any day of the week. No matter what day of the week it was about 7 p.m. The number of people severely injured in the first 3 months of this year was 269, again, lower than 2023 and 2022, but we're still waiting on those police reports. The slope is increasing at a higher amount than the deaths were already. We're likely to see an even greater increase as police reports come in. Here's a map of where those severe injury crashes were located. And we have a tie actually for 4 and 7 p.m. had the most number of severe injury crashes across any day of the week. Moving to specifically pedestrians, we had 52 pedestrians severely injured in the first 3 months within the AMPO study area this year. That is a significant increase and is something that has doubled since 2010. I want to remind y'all that we are a Federal Highway Administration pedestrian safety focus area, which means throughout the entire country, we have a higher rate of pedestrian deaths and severe injuries compared to the rest of the country. So AMPO has designated that a few years ago. We continue that. And you can see that our 5-year slope is still sharply increasing. The number of, that was severe injuries, sorry. I did that backwards. 52 people severely injured, 19 people killed. Still a terrible thing to see. We have a 5-year slope is still increasing. And again, as we get more data, that slope is likely to increase even more. So 52 severely injured, 19 people killed. This is a map of where those pedestrian fatalities occurred, most of them being in the San Antonio area, as well as a few being along the I-35 corridor. 34% of all of our traffic deaths in our region were pedestrians in the first 3 months of this year. That number was 28% across the last 5 years. So the first 3 months of this year is seeing a greater proportion of our pedestrians being killed as a matter of our overall crashes than they were in the past. So we keep seeing that trend of pedestrians, more and more pedestrians being killed, and that being a greater proportion. Again, 7 p.m. is when we see the most frequent number of severe injuries and deaths. People cycling, we had 9 people severely injured this year in the first 3 months while cycling. This is, again, another severe increase in our 5-year slope. We're seeing that number increase as our 5-year average. The number of people cycling killed, however, we are seeing that slope decrease. It's a small decrease, but we are seeing it decrease. Again, these numbers might change as police reports come in. I'm sure we've all seen news stories of people killed cycling, and we'll probably see those police reports come in and see that slope change. The majority of these crashes, if not all of them, are going to be on the south and west sides of San Antonio. The one death happened on near Presta, near the Missions on the south side, as well as some along the 281 corridor on the north side of town. That's going to be a wrap up of just the data from what we've seen in the first 3 months of this year. A lot of our deaths and severe injuries are trending upwards at this moment, and I will be open to any questions at this time.
There was one in the chat, just from Yvonne asking if she's just confirming only what part of the Medina County is going to be joining the MPO.
Correct. Only about 60% of Medina is going to be joining. So all this data had all of Medina and all of Kendall. And AMPO will be taking all of Medina just past Hondo, which is where that big red dot is. So we will be including Hondo in that AMPO area next year.
Is that red dot, big red dot, which tells you how many, is that in Hondo, that's past west of Castroville?
Yes.
Whoa. Okay.
Hey, Matt, this is Scott from Shirts. Hey, is there somewhere where a guy can go on and look at the data, look at maybe a breakdown of the data? Of course, I don't need names or anything like that, but maybe age of the people injured and age of the people killed, or any other, or 2 or 3 in a group. You know what I mean? Is there somewhere where a guy can go look at some of the information that's on these slides and it's not just a number in your face?
Yes. The CRIS database is something that AMPO takes the data from, and then we plot it on these charts, and we create kind of this diagram that puts them, geolocates them, and then you can click on each of those dots and it'll tell you the police report summary. It'll tell you what time of day it was. It'll tell you the reason for the crash, how many people were killed, how many people severely injured. It breaks it down by transportation mode. It does not have names, and it does not have age. So that is something that it does not do. But if we want to know factors such as weather and any factors relating to why the crash happened, we can definitely separate those factors out. But
Can you share that CRIS database site with us in the comments, maybe?
what was that?
The CRIS database, can you share that? How do I access that, CRIS? I put stuff in
Yes.
before, but I never have
So
access to it.
this specific data is not on our website yet. This is the first time it's being shown to the public. We will be updating this data on our website. Generally, if you go on the AMPO website and go to the data tab, we do have a crash record information dashboard where we show this data, but it is not up to date. This is the update, and we will be posting it on our website soon.
Crash dashboard.
You can pull your
crash report, you just Google Chris, text about Chris, and you can make your own query, and it'll tell you for each crash, the age of each person. If you want to,
Yeah, we don't do that because generally when we make these, it's public facing and we don't do that.
This is Ryan Flipson online. Just a quick question. With this data, is there any current preventative or promotional things going on to reduce the numbers?
Generally, we keep track of this data and we like to report it out just so that everyone's aware. We are federally required to report these numbers at the end of every year. That's called our performance measures. And performance measure 1 is the safety performance measures. We track all 5 of the things I presented today and report that out to the federal government. And that's how we get our designation. And that's partially what would help us kind of ask for that SS4A money or any special trainings that the Federal Highway Administration would want to do here relating to pedestrian safety. So in terms of advertising and trying to get people to be more aware of it, we do not publish these numbers in that way.
Hey, Matthew, it's Josh again. You know, in looking at these numbers, the thing that always comes to me is what types of facilities are we talking about? A lot of these numbers are aggregated in a way that categorizes them kind of all to be one and the same when we know that's not the case. So as you publish your data, you know, is there going to be an effort? And this is something that we do at the city is we look at the facility types, but I think getting a regional picture for all of our members and the area would be really helpful in identifying what are the facility types, what are the common denominators, are they state, are they locally owned, are there, you know, incidents occurring in identified high injury networks over and over again across the cities that are in this region? You know, is that something that we could take a look at through the MPO?
Yes. So Chris does track the roadway classification of those roads that these crashes occur on, whether it's an interstate, just a normal freeway, an arterial, a local, or a collector road. It separates it out, so we can separate those out. Obviously, the freeways will be mostly state with those interstates as well. So we can look at it that way. We can also look at the city limits and the county limits, so we can separate that data out in that way as well. So there's a couple different things we can do with the data, and I can definitely show that at our next quarterly update of these numbers.
Yeah, that would be awesome. And the next question I have is, you mentioned that, you know, these police reports are still coming in. At what quarter in the year do we start kind of assuming that they're more accurate? You know, we're in Q1 now, and it looks like that number could continue to trend upward from where it's currently at, as it typically does.
So that's where when you do a Chris query, it's not going to be 100% accurate. It's going to be as accurate as possible. But you still would probably want to go through the data and make sure there's no replicas of the data when you do that query. We do our best to go through that as well. However, there are occasions where we go through it and we see a duplicate and we go out and remove that. Generally, here at AAMPO, we assume about 6 months after is when the vast majority of those police reports would be in, and we can assume that that data is about where it's going to level off.
Okay.
The vast majority will be within the month after, and then the rest we assume will be within those 6 months after.
Okay. And one last question, sorry. Regarding reporting from police reports, are those reports uniform? Is that state law, state established? I mean, if one...
all police departments are required to fill out that report for fatal and severe injury crashes across the entire state. So yes.
Okay. Yeah. Thank you.
Bert, it looks like you said on pedestrian incident data, it's good to know locations, but you can't vary incidents to pedestrians if you don't know number of users. You're right. So that is something I do try to keep in mind when making these presentations. We don't want to come off as just saying that these people are numbers, they're another statistic. We try to make sure that we're saying these are people involved with these crashes, with these severe injuries. A lot of the language we're moving towards used to be just traffic deaths. Now we're moving towards people killed, just to make sure that we make a more active role in our language to emphasize that the person affected by this crash. So that is something that you saw a little bit of here today, and that's something that we'll continue to move towards, making sure we emphasize the person.
Right. Thanks for the info.
All right. Any other discussion?
Okay, this was an information item. Thank you, Matthew. So we'll move on. No more questions. Item 6 is presentation on the AAMPO's recap of National Bike Month. This is you again.
All right, something a little happier. Bike Month recap. AAMPO had a great Bike Month. We did a lot of events and participated in a lot of events. We talked to a lot of people, gave out a lot of helmets as well. So here's a list, a calendar of what we participated in and hosted. If you have your microphone on, please make sure to mute that. On May 4th, we participated in Safe Kids Day, which is run by University Health. We hosted the trail activations in Barranquilla and Guadalupe counties. We also participated in Activated Safe State of the Bike Community, as well as ATAC Social Rite of Silence, and hosted Bike Day as well. So we'll just go through each one of them real quick and talk about where they happened, when they happened, and their purpose, and how many people we reached. Bear County Trail Activation, POSA, Transportation Department was at LBJ Park. AAMPO was at Wilshire Terrace Park, and we asked people to ride from one park to the other. We stamped their little book, and they got a prize from POSA. That was from 8 a.m. to 12, not midnight, 8 a.m. to 12 p.m. on Cinco de Mayo. We had about 25 people participate in that event. And as y'all know, we host Bike to Work Day every year. And generally that targets people who are already comfortable biking on the road with vehicles. So we wanted to do something this year, such as the trail activations, that targeted that most people who are not comfortable riding their bikes on the road with vehicles. We wanted people to look at their off-road trails and target that group. So that's why we did some of these trail activations for each one. Claremont County Trail Activation was 1 week later on the 11th of May at Fisher Park from 8 a.m. to 11 a.m. Same goal, we wanted to target the people who are not comfortable riding on the road. We had about 40 people stop by our booth that morning to talk about cycling and get more safety information. We went to Activate SA, State of the Bike Community. It was at the Herman Sons Ballroom on the 14th. POSA, TxDOT, and AAMPO were all there. And we educated and celebrated the achievements of the cycling community, talked about the plans coming up as well. We had 75 members of the public, which if all the governments out here, 75 members of the public is a lot. So I attended the Social Ride of Silence held by SATX Social Ride. It was at Main Plaza on May 15th, and it's meant to honor victims who have lost their lives while cycling in the San Antonio area. You wear white shirts, you can write the names of the cyclists who died if you would like to. I represented AAMPO and ATAC at that. There were about 100 cyclists participating in that. Here are some of those pictures as well. It was a very great event. I highly recommend you'll go next year, even if you're not used to riding on the road. It's very short, it's a very slow and safe event. Bike to Work Day. This was a busy week. From the 11th to the 17th, we had all those events. We had 14 Energizer stations that Friday. 7 a.m. to 10 a.m. There are some of the pictures on the right. It's meant to celebrate and encourage those who choose to cycle to work in an effort to increase education of alternative modes of transportation. Here are those 14 Energizer stations, 12 of those being in the San Antonio area, 1 in New Braunfels, 1 in Seguin, to round out that 14. We had a survey, which doubled as our sign-in sheet for Bike's Workday. We had over 209. This number was when I made this presentation about a week and a half, 2 weeks ago. That number's more like 250 now. We had 209 cyclists, 250-ish now. The average number of miles for a one-way commute was 5.06 miles on bike to work day. I told you all last meeting that 52% of all trips in the US are less than 3 miles. So to see the bike to work day miles at 5 is pretty impressive. We had 22 unique home zip codes represented on bike to work day and 18 unique work zip codes represented on bike to work day. We also asked what would make people more willing to bike to destinations that are less than 3 miles away. The majority of people said more bike lanes, better roads. I thought better roads was interesting because that can mean two things. One, better asphalt pavement condition, or two, better road design. Do we know what they were referring to? No, but that's just something to think about. People also said clean bike lanes, bike storage, better bike lanes, San Antonio plastic, no dogs, and separated bike lanes as well. Here's a map of where we got a lot of those responses. Most of them are going to be in the downtown area for San Antonio. We had a lot of response for Seguin as well. These are the work and home zip codes. This is specifically the work one. So all the work ones we got were in San Antonio. And the number of miles for a one-way bike commute. Generally, the San Antonio downtown area had the least number of average miles. We had this one out by Randolph that had 20-something miles as a one-way bike commute. So I guess that really skewed that data.
That was Scott Bateman, probably.
No, it wasn't me, but I probably know who it was.
The very next morning, we went to Stark Park East with the city of Seguin from 11 to 2. We distributed 40 bike helmets, and the city of Seguin raffled dozens of bicycles to children at their Badges, Bikes, and Tax event, meant to support the community and explore nearby trails, as well as just generally making people more excited about cycling. And we had about 400 members of the public at that event. Who knew if you gave away free bikes, people would show up? We also held the Annual Commutes Challenge. Shout out to Zach for setting that up. That was from May 1st to 31st. I believe we're going to be announcing on social media those winners soon, so keep an eye out. We chose a random winner from the top 5 cyclists who reported the greatest number of trips each week. We had 4 winners throughout May, and we picked a random from those top 5, so it wasn't the same person every week if we had the same person doing greatest number of trips. Again, 52% of all trips are 3 miles or less, so we wanted to target that with this, again, this year. We had 855 bicycle trips reported on the app this year across 50 participants. I was one of them. And it's cool to see that the average distance is actually pretty similar to what we saw on Bike to Work Day, 5.4 miles. Keep in mind that some of these are probably going to be recreational trips, so that might skew the data higher than it normally would be as well. This is a heat map of where those trips were reported by location, majority being downtown, some of the northeast, inner northeast side, as well as the northwest side by Bandera Road, 4. These are the number of bicycle trips by zip code. The west side and the northwest side were very represented in this case. Again, this is the schedule of events that we participated in. And if there are any questions about Bike Month this year, or any comments about what you would like to see AAMPO do for Bike Month next year, we'd love to hear them. So.
I would just say if there's an opportunity for more public advertisement that's not social media, our station just all had a lot of people come by, and we had even more people zip past because they didn't know what was going on. And people who do cycling as the mode of transportation to get to work, they need to be able to plan for that couple-minute stop. But these are people who were really state cycling as a mode of transportation, and they didn't have the time to break in and ask what was going on. But, we had a really great turnout. It was really great to see that there is an active community using bikes. It'd be nice to be able to reward them and let them know that we're out there.
I completely agree. The AAMPO station here, we only had about 50% of all cyclists who rode by stop at our station. So that 209, 250 number I told you, that was just who stopped at our station. We had an equal number, actually, we had a greater number of people who didn't stop at our station, who we saw ride by in St. Mary's or on South Alamo, just kept riding and didn't want to stop at our station. So we also kept track of that number too. However, that one's a little more fluctuating. Some stations did it, some stations didn't count. So I didn't want to report that number because it was inaccurate. So also, this picture is great with the mom and her child on Bike to Work Day this year. So.
This is the information item. Thank you, Matthew. Is there any more questions? Okay, we'll move to agenda item number 7, which is a presentation on the one call, one click overview by the San Antonio Area Foundation. So ladies, it's all yours.
Oh, thank you so much. What an interesting presentation. Thank you so much for inviting us to talk about the one call, one click. Although from this meeting, I won't be going and meeting people at 7 o'clock in the evening because that doesn't seem to be the best time to be out in the street, whether you're walking or driving. So good to know. Okay, so my name is Jane Passioni. I think I saw some familiar names online, so shout out to the people we know. I am Managing Director of Collective Impact at the San Antonio Area Foundation, where our mission is to, I'm looking at my slide going, is this the right one? No, okay, but anyway. So at the Area Foundation, I lead an initiative called SALSA, which is Successfully Aging and Living in San Antonio. And our mission is to transform our community by advancing practices and policies that improve the qualities of life for older adults in San Antonio. So we are 60 organizations strong and 130 people partners. So again, the Area Foundation, you guys know us. We've been around 60 years, and we are the place where people who want to give to community come give to community. I'm here to talk about something that's amazing. We have a population shift going on in America. On the left side of the screen, you can see like a pyramid, and you can see back in 1960, we didn't have that many people aging past 85. When you fast forward 100 years, you can see that our population has changed completely. Many, many more people 85 plus living longer, not necessarily healthier lives right now, but we're working on that, but definitely longer lives. And you can see on the pillar side, on the right-hand side, that we have sort of a nipping in of the population, less children being born. So that's why I'm here to talk about a one call, one click, because we are, you know, as Americans, and I can say that because I became an American in 2019, as Americans, we outlive our driving abilities by about 7 to 10 years. So just think about that for a minute. In San Antonio, we outlive our driving abilities by 7 to 10 years. What does that look like as we age? So here's some transportation facts. We have about 5.8 million Americans miss medical rides, medical appointments due to lack of transportation. And there's my little other stat up there. But here's some things that we wanted to share with you. VIA buses do not operate throughout Bexar County, and VIA Trans has strict eligibility standards. So when you're older, it's not necessarily you're going to have access to VIA Trans. That might not be open for you. COSTA provides rides only for residents within 5-mile radius of senior centers. So sometimes you see those vehicles going around, but you have something within 5 miles to get that. Uber and Lyft are not required to accommodate wheelchairs, walkers, oxygen tanks, service dogs. They're not required to do that. So someone who looks like me, I'm a wheelchair user, and Uber and Lyft might not be the ideal thing for me, right? Because I'm going to take longer to get in the vehicle. And if you're there trying to make money for your family, I'm probably not the best ride for you. So nonprofits, we do have community transportation providers at SALSA in our community, but they can't fill all the transportation gaps we currently have. And, you know, technology doesn't solve everything. Many older adults have issues with accessing or usage. So when we look at moving older adults and people with disabilities, we really need to look at it a little more in depth at these different levels of service. So we have someone who can jump in a vehicle, go curb to curb, that's your Uber user, right? If they have the funds for it. We have other people who really need help at the door. And then we have more people needing that door through door, someone to come in, get them into the vehicle, get them where they need to go, stay with them, and do the reverse on the way back. So when you think about that, that's a pretty complicated thing, right? When you're thinking about all these different levels that we need to be looking for. So right now, older adults and people with disabilities go through a lot to make their transportation planning. So they may call Ride Connect Texas or PRESA. They may have medical rides through their insurance or Medicare coverage. They may be via trans eligible. They may use regular bus. But there's a lot going, they have to make these individual calls. And prior to my position at the Area Foundation, I was actually CEO of Ride Connect Texas, a nonprofit organization that was housed on the south side at that time to help people with disabilities and older adults navigate their transportation. So about 6 years ago, we just worked that out the other day, 6 long years ago, we started talking about what is the biggest issue for older adults and people with disabilities, and normally it's transportation. So we can have the best events in the world, best medical care, the best groceries or food outfits, but if we can't get to them, what's the use? So a one call, one click, and I'm not sure, has anybody here heard of one call, one click before? Okay. So it's a process, it's a system where an older adult or a person with a disability can call one number or click on one website and get their rights navigated. There's a lot in the background that goes on this, but it would be all these providers in the background giving, getting, coordinating, building efficiencies in getting rights for older adults and people with disabilities. This is an example of a very high design functioning one call, one click. But you can see the rider at the top, and you can see how this sort of comes down into ADA paratransit, the Uber and Lyft, the taxis, the volunteer driver programs, the veterans programs, and the senior center. All these people currently do not talk to each other. There is no way for me to take, if I was using Via Trans, for me to take a Via Trans one way and for me to get a different type of ride on the way back. So say I go to a doctor's office, or I have a doctor's appointment, and I'm using my medical provider to get me there. I'm probably going to need to use that on the way back too, as a round trip. But what if I wanted to go to HEB or go out and have taco afterwards, right? Those things, when you do medical rides, are only doing medical rides. There are no social rides. So you can see this looks pretty complex, but this is the background. Here's one that would look like on the other side. So someone getting that ride, you can see there's eligibility indicators, transportation preferences, accommodation requirements. We know that all wheelchairs are not made the same. So you get some that fold, some that do not fold, like the one I'm in does not fold. And we know that some need wheelchair lift ramps, some of us need curb to curb. But here you can see, this is an example of someone wanting to go from, let's see, lives on Frio, wanting to go to the medical center. And you can see the system actually conjures up, hey, who can do that? Well, Via Trans can do it, and Ride Connect can do it. So about a year ago now, Ride Connect Texas got some ARPA funding from the city of San Antonio to work on a readiness assessment plan. We selected the University of North Texas to help us with the research for this plan. How ready are we for this type of system in San Antonio? So I'm going to share a little bit about where we are on that system. So the readiness assessment contract went over a couple of things, the institutional and collaborative capacity assessment. So we picked institutions that give rights to older adults and people with disabilities and asked them, what's your capacity? How do you do what you do? We also did a national review of the one call, one click. Other cities have this type of, they're having the same problems we are, and they have this type of systems, and what are we gaining from that? We also did a ridership survey that was out there because we wanted to know, hey, where is it? How many rides are you missing? Where aren't you going? Where would you like to go? And we also did something that was really intense. We had focus groups. So older adults and people with disabilities where we asked them facilitated questions guided by the University of North Texas. And I will tell you, the struggle is real out there. If you don't drive and you have a disability, it is real. I had a lady in the behind me lean forward and said, I just want to cry. It was one of those very moving things. So we have a group that is severely restricted in mobility and independence. We need this one call, one click to help us get past that. This report is actually going to be ready the end of August. So really, what are we talking about? The manifest demand rides on the left-hand side, and I have Sarah right here who's going to correct me if I'm wrong here. The manifest rides on the demand side in the green box, those were the rides that the institutions that we interviewed said they were unable to meet. They were unable to meet those rides. So that number in itself is pretty big. The number of rides we were able to give last year, 1.6 million rides last year. But with a certain set of, what's the word I'm looking for? With using the data and the rides that, Sarah, help me out here, this piece.
Sure. So with our rider, should I announce myself?
Yes.
Okay. Hi, my name is Sarah Ford, and I'm from the University of North Texas. I'm one of the research assistants on this project. So the latent demand is part of what we did with the ridership survey was figure or calculate the daily trip rate. So how many trips per day does someone in our transportation disadvantaged population need? And we came up with a number of 0.68. And so the latent demand is the total number of people who fall into our transportation disadvantage definition times 0.68 times 365 to get that yearly need for rides. And so that's what the latent demand number represents.
Sarah, thank you for filling that in. I knew I was going to flop all over that, so thank you. As you can see, it's a lot of rides. We're missing a lot of rides for this transportation disadvantage group, which are people with disabilities. And in this case, in this research, it was people over 65 who were living in poverty. So we desperately need a one call, one click. So what are the benefits of a one call, one click system? For riders, the one call, one click is a designated one number. Accessible to riders and their caregivers, and it really does increase independence. And I just wanted to do a shout out for the person who just arrived, Dr. Amanda Villarreal is the CEO of Ride Connect Texas, and she was the one that thankfully submitted the grant request to the city of San Antonio for the ARPA dollars to get this readiness assessment done. So thank you, Amanda. So what other benefits do we have? Well, the actual transportation providers, right now, just knowing what that gap is so important, right? But having those operational efficiencies is where we're at. Comprehensive transportation management system and improved data. We need to know more about this group. Community, wow, I can tell you, with all those rides going missed, the economic impact is, would make a severe difference to San Antonio. We, of course, have heard a lot over the last couple of years about social isolation. And this will go a long way to reduce social isolation. And that in turn will improve health outcomes. And this really does advance that age-friendly goal that we all want to successfully age and live in San Antonio. So why now? Well, I showed you that growth image earlier, we are having more people living longer lives. And so that's why now we need the infrastructure for the agencies. There's so much that goes into this first mile, last mile, and the accessibility of how do we get to these rides. So infrastructure, impact on sidewalks and stop locations. Since the pandemic, I think Amanda would share with us that it's been a real challenge to get those volunteer drivers who can do the door through door. We do not have anybody in San Antonio currently that does door through door for our older adults. And so that's a real challenge for people who need that. And there have been post-COVID significant delays on purchasing new vehicles, especially the ones we're talking about are accessible vehicles. You know, this is a topic that is out there in many cities across the United States. And this report to Congress came out last month and basically had a piece in there and said the focus is a real focus on transportation. So we're going to see more plans, strategic frameworks and goals that actually talk about one call, one click. So what are our next steps? I told you that the report is going to be finalized at the end of August. We're very happy to get out there and start talking to any groups that want to know more about one call, one click and its benefits for the riders, communities, and all. So we have spoken about a pilot project, possibly that might be up there, where we would have the community transportation providers really develop a memorandum of understanding about data sharing, maybe a universal application with no wrong door. The readiness assessment, as it stands right now, is promoting how we prioritize our infrastructure to promote improved accessibility and walkability. And I'm going to add rollability in there too. We need to start considering preparing for the bond election in 2027. Community outreach, just educating people on transportation needs or transportation planning, what happens when you no longer drive or can't drive. That's really important. That's going to be ongoing. Driver training, having a common city level driver training program will benefit every provider. Because right now we have people who are taking older adults and people with disabilities, and they're not really trained to do that. And that can lead to other problems. And then, of course, we need to designate a lead entity for the one call, one click system. So all these coordination and management issues can be resolved. So the good news is we're aging, and that's cool. That's really cool. But transportation really does continue to be a challenge for many people, older adults, people with disabilities. And so I'm hoping that the shout out is, if you want more information about a one call, one click system, if you think that's something that you can help promote or you have an idea, please get a hold of us at the Area Foundation and let us know. And maybe you can join our transportation work group. And I feel like I've been just talking for a long time, but I probably haven't. But I can entertain any questions you have at this time.
Someone online, you want to-
What did Bert say?
First,
It's on my side coming.
I've been to this during the Joint Commission now, yeah.
Can you read it up here?
I got it. Bert said, good info, Jane. We covered much of this during today's Joint Commission on Elderly Affairs. Bert represents health and wellness, besides walking, in our meetings throughout communities. He hopes to connect you later with the JCOEA and Mayor's Fitness Council, and Bert's contact info is there as well.
Thank you, Bert. It's good to know you're out there still. Anybody here?
Anybody online, comments, questions?
Yeah.
Thank you, Jane and Sarah. Appreciate it. It's good information.
I have one additional comment. This is David Frost. I've been working very closely with Jane and Amanda on this project for many years. And there's a couple of other things that are important about the one call, one click system. It's clear from the information that we've been able to gather anecdotally and in terms of survey and research that the need out there is substantial. And there's going to be, we'll definitely need more resources in the community, public and or private. And one of the values of the one call, one click system is that it maximizes the existing resources. So we can say to potential new funders or new providers, look, we're doing the best we can with what we have, but we need more. And also, a one call, one click system is a system in which a new actor, a new provider can fit right in and be effective, maximally effective from the first day. They don't have to establish new relationships or things of that nature, figure out what the land is, lay of the land is. That will all be there in the one call, one click system. And a new provider or an expanded provider will be able to plug right in almost from the get-go.
Thank you, David. Amanda, did you want to say anything before Gemma?
My apologies, I was late on what I did, because it was raining. The young lady did not have insurance. But our pastor Janice was anchored correctly in Roseville, and she says she declared she was fine. So, so I apologize. I just want to let you know that we're in the state, and the growth of the elder population community transportation for this farm is it's been every single day. And so with that being said, we're doing everything possible. And right now we're trying to work together as much as we can. But something like this would really create a cohesiveness that San Antonio does not have at this time. And the growth of San Antonio, the expansion. So the medical center, I don't know, medical center are outside of San Antonio. And now these elders don't have this, the transportation. And a lot of them are afraid that they're going to drive in the cars and will 2 to 5 mile radius. So when it means getting out to going to the doctor that's out at 151, that's out at Tonawanda Road, this is where it's getting harder and harder for them to drive to these areas. So that's just, it's just, we see this every single day. And so I just want to I know Jane said it, we all know that, I mean, it's hitting us hard every day. And you do all these new applications that call everybody else and stop. It's very tough for these folks. So this is the project to help. So thank you again for the time to present this to y'all.
I believe they will be at the Technical Advisory Committee in August. So if anyone has any more questions or comments, feel free to join that Technical Advisory Committee meeting as well. Yeah.
If there's no more questions and comments, I appreciate this presentation from Jane and Sarah, and appreciate Matt's input. Thank you very much. And we're going to go to our next item on the agenda, announcements and future agenda items.
All right, first announcement is that AAMPO will be closed next week on June 19th in observance of Juneteenth, as well as on July 4th for Independence Day. One last thing, Joshua Jeschke said, thank you for your work you are doing and for the informative presentation, y'all. So I do want to say that the July ATAC meeting will be canceled. Usually we have low turnout in July. We have a lot of vacations that happen for the summer, so we'll be canceling that July ATAC meeting ahead of time. And I will actually be on vacation in August, which means that we will reschedule that August meeting from the second week of August to the 1st. So that means that the next ATAC meeting will be on August 7th at 3 p.m. And we are open to any other announcements from any other members of ATAC.
Hey, Matthew, let me ask you a question. Aren't we due to vote on an alternate member for ATAC? Or is that all resolved?
That's all resolved.
Okay. Next question I have is something that I've observed. I don't know how we do this and how AAMPO can be part of this, but I'd say in the last month and a half, twice when I've gone down Avenue B from Jones to Brooklyn, there is that divided lane where they have bicycles and you have islands of trees and driving in the street. And so it just happened to be that one of those times was my wife. She was, aren't you getting bike lanes for the people? He just threw recommendations. And I said, yeah. She goes, why do these three bicyclists have to be down the middle of the lane when they have a bicycle lane they're not in? And then a lot of times I'll see that on McCullough, that we're going down the lane between Almas and Bassey, and there's bike lanes on both sides of the road. So I don't know how we communicate that with people, but if we're going to go to the effort to try to accommodate and make it safer to ride biking, they need to reciprocate by driving in the bicycle lanes.
I will say it is not required by law at all for cyclists to be in the bike lane when there is one present. Same with walking on the sidewalk in Texas. Even if there's a sidewalk present, it is not against the law to walk in the roadway for multiple reasons. It could be that there's barriers on the sidewalk or any of those reasons. So we do not do that messaging here at AAMPO for that reason, because it is not a law. And there could be many reasons. The cyclist is taking a left turn. The cyclist simply just feels more comfortable. They're one of those road cyclists who wears the Lycra and likes to go longer distances, and they would rather be on the road. But we build those facilities for those people who would not feel safe riding in the road, for the people of all ages and all abilities, so that they feel more comfortable using it. So I will say, I understand the frustration, but I do caution against using.
Yeah. I mean, all I'm saying is that we've made an effort to improve pedestrian safety and bicycle safety, and we put in a lot of dollars and amenities to provide that safety. And if you're comfortable on the road, that's fine. This is like 3 blocks that I follow them. I couldn't pass them. I mean, it's a one-way thing. The question is what do we do to educate? Because I understand, since I've been doing this for 14 years here at AAMPO, that for the people who don't have that perspective, and they get frustrated with that. And, so, I hear a lot of comments, and you don't understand the process. This is just the way it goes. So how do we educate people to say, we've got a bike lane, there's a lot of dollars put into it. Why don't you ride in the bike lane if it's in the road that you're on? And so I'm just, I don't have an answer when somebody asked me that question, to be honest with you. So it's frustrating, but, I don't know what you do. It's just like people not crossing into crosswalks. It happened today coming down Cesar Chavez. I mean, right between, and there were 2 policemen because of the construction, right in the middle of the block, just runs across.
Right.
Well, our goal as an active transportation advisory committee is because you made a comment earlier in today's meeting about what we're classified by the federal government, is because I think that when we did the pedestrian safety action plan back in 11, 12, maybe 15, we were designated as we had 18% of pedestrian deaths versus the national federal guideline, which is like 9 or 10%. So it has an impact on our funding. And so we've had to work, and we developed that pedestrian safety action plan for the city to try to solve that problem and to get out of that thing where it's like congestion management. We have that designation on the thing that we talk about in TAC because of issues. And so how do you improve it? And that's always the particular thing that we're trying to do, is improve it. So we did a pedestrian safety action plan. Has it reduced the pedestrian safety, pedestrian deaths and fatalities and injuries? Not very much, but we're doing something. And there seems like there's an educational component that we as an organization could do to get the information out there. We have the bicycle month and stuff like this, but there's an educational component about where you should cross streets, and where you should bike if there's bike lanes and stuff like that. So it's a thought under other business.
Right. No, I agree. October is National Pedestrian Safety Month, so we will be targeting pedestrian safety as a whole, and messaging towards being safer towards pedestrians. There are many factors that go towards the increase in pedestrian deaths. I don't think it's solely because pedestrians aren't crossing where they're supposed to or out of in the roadway. I think it's a whole combination of things.
It's not black and white, is what you're saying, it's gray.
Yes.
But what can we do to educate? So in other words, in October, if it's pedestrian safety month, then what do we do to engage the media and communicate that to the larger masses?
I would like to say, in general, one thing that we can communicate, and I think it's a good focus following up on the topic that we just talked about, is that roadways are for road users of all types. And that's not cars exclusively, that's not able-bodied people who move at a certain speed. You have road users of all ages and abilities that move at different paces. Even regardless, if we're talking about vehicles only, we have rules of traffic that slowest traffic is on the right and fastest is on the left. That doesn't limit cyclists or road users of any way, but you have people that feel confident in moving faster. And people who are building that confidence or maybe are working on that and they're moving in the bike lanes, the trails, and other ways. I think the best education, the best answer that you can offer going forward in a situation is that road users are diverse and they're not car-centric. So regardless if it's frustrating or going against how you navigate the road, you have to keep in mind that there are other people using the roads in different ways.
I understand what you're saying, but as a community, and if you're going to say, hey, don't use bicycle. Why are you saying when it's still true?
Yeah, I understand that, but I think there's a responsibility that needs to be put on drivers.
Correct.
And we can collectively center that in the conversation. We had a death of a mother and child that were hit in a Stone Oak area. They were on the sidewalk at a crosswalk, a place where there is infrastructure. And it was driver behavior that resulted in that fatality. You can't build your way out of that. You can't force your way out of that. I mean, that's like
try to think about this just now. You talk about driver responsibility. What about pedestrian and bicycle responsibility?
I don't think she's trying to discount that. I just think it's trying to say that drivers are, I think that it's a cultural thing and an educational thing in Texas, and that driving is the norm here, and that people tend to forget that driving is operating heavy machinery, and that you have responsibilities. You have a greater amount of responsibility because of the amount of damage and death and severe injury you can cause when you do make mistakes while driving. So we put in this expensive infrastructure to mitigate that impacts of driver mistakes. But the ultimate person responsible, again, is still that driver who is operating that heavy machinery. So that's what AAMPO is going to be moving towards in the future, is making sure that we encapsulate that all users use the road. It's not, roads are not just for cars. Highways, yeah, highways are just for cars. You don't want pedestrians on the highway. But streets, roads, and urban areas are going to be for all users. Emphasizing the message, in the state of Texas, every single intersection is a crosswalk, and pedestrians have right-of-way. If you're on San Pedro, it's 7 lanes wide, and someone's crossing at a minor road, there's no traffic light, no stop sign. Legally, you're supposed to stop anyways. We don't have that infrastructure there that would allow them to safely exercise their right-of-way. And so education is a huge thing, because when there isn't that infrastructure present, it's that education and that, it's that education that ultimately will make the huge difference.
Which is how I started my comments about education, because for all practical purposes, the goal is AAMPO is safety, whether it's pedestrians, the driver, bicyclists. It's all about safety. And so what do we do to sort of improve that? I mean, we did this, it's now 11 or 12 years of pedestrian safety action plan. I've seen very few improvements to the city's infrastructure. And as a matter of fact, it was a very contentious thing about whether they would approve this because we had too many models of where there was bad pedestrian safety. And we had to go with the chief of public works and Councilman Lopez at the time said, look, we're going to be findings, but don't think just because you have bad infrastructure, it's an impact on pedestrian that makes you look bad. So that it's the politics, but at the end of the day, it's about safety, it's about education, but it's education for everybody, not just the drivers, not just the bicyclists, not just the pedestrians. So what can we as an organization do to help broadcast that out in the community?
Yeah. At the September meeting, I believe I will come forward with a plan for the events as well as the messaging that AMPO will be doing for National Pedestrian Safety Month this October. So y'all can expect that this coming September. In the future, AMPO is not currently able to get funding for, I believe it's SS4A grants. That might be wrong, because we need to update our safety action plan here at the MPO level.
We've talked about that in the past year.
Yes, so that is something we will be looking to do in the future and talk about with y'all in the future, probably in the next year or so. So
yeah, and for those people that don't know, the federal pedestrian safety action plan template was done by Tool and Associates. He did the same pedestrian safety action plan also. Is there any other, any more comments or announcements that anybody has?
Yvonne said cyclists can take the lane if needed, even if there's a bike accommodation, and that TxDOT has a bicycle safety guide brochure that can be shared with the public. It contains information on rules of the road as well. So.
And we also have just all those cycling in San Antonio and Austin that is not only senior centers, community centers. We also visited elementary schools for the fifth graders, and we're delivering that message of cycling safety and bike literacy and how to navigate the roads according to the TxDOT law.
And that's been going on for a few years here. That's somewhere. Yes.
Any other announcements?
There's no more comments. It's 4:20 and the meeting's adjourned.
Thank y'all.
Thank you, guys.